The Eastern Cape Health Department has confirmed that 50 New Year's babies were born by 10 a.m. today, including a 12-year-old mother who delivered at Frontier Hospital in Komani. While mothers celebrate their newborns, teenage pregnancy remains a critical issue. Between April of 2024 and October, over 4,000 girls aged 10 to 19 have given birth in public hospitals, with 94 of them aged between 10 and 14. The province ranks third nationally for teenage pregnancies, highlighting the urgent need for stronger interventions and education on reproductive health. Newzroom Afrika Sipha Kema joins us from Dora Nginza Hospital, where the MEC of Health is expected to visit the New Year babies. Good afternoon once again to you, Sipha. I believe the MEC has arrived in order to welcome those new babies, but there's also reports of an abandoned baby who was found in a bag at Cecilia Makiwane Hospital.
Yeah, that is correct, Katlego. But just to give you the latest on the numbers, as of just a minute ago, 76 babies have been welcomed in the Eastern Cape from various parts, of course, of the province. Now, as you mentioned, that we also just received news from the Department of Social Development that a newborn baby was found in a black plastic bag just outside Cecilia Makiwane, outside Unit P, close to Mtanzane, where they had actually opened the bag. They had noticed that there was a bit of a foul smell there, but the child was rushed the baby was rushed to Cecilia Makiwane. I think before we talk about, the issue of teenage pregnancy, as we know that the youngest mother, having been 12 years old, Katleho, let's bring in the MEC now to just discuss, of course, the celebrations, a new life, New Year, and you're here to hand over some gifts to those mothers.
Definitely, we are excited to welcome the newborns in Dora Nginza. This is our hope as a province in terms of maternity. So we are really excited. We've received about 13 in this hospital. But of course, as you said earlier, what saddens us is we received that a 12-year-old gave birth today at 12 midnight in Frontier Hospital. We are making a follow-up on that as a department, together with the Department of Social Development. A social worker has been sent, and we've already found out that the father is a 17-year-old boy. So we are looking into it, but we have agreed that we're not going to release the mother until we get to the end of it. We'll meet with the family tomorrow, but we have roped in social development.
What other steps will be taken? I mean, even though the 17-year-old is also fairly quite young, but 12 years old, statutory rape, he's over the limit of the age, the legal age.
Hence, we are bowing our heads together with Department of Social Development to see what is it that we can do. That is why we are also agreeing that we are not going to release the mother until we get to the finality of this. And again, we are meeting with the family tomorrow together with Social Development so that we take necessary steps.
Now, MEC as a whole, I mean, it is a problem in the Eastern Cape. Looking at the stats just from last year, April 2024, up until September, just 4,000 children, mothers actually had given birth to 4,000 children, 4,000 stats of teenage pregnancy in the Eastern Cape. That's a large number. What exactly is going to be done about that? I mean, educating young children regarding sexual reproductive health.
Definitely, we're going to do that. We do have a program which is called Integrated School Health, but we want to put more energy into it and see what best other options that we can do. We are even thinking of engaging traditional leaders. We must engage Imbubama Koskaza Komkulu so that we talk to the parents as well, because they have a role to play. Communities have got a role to play. Because remember, when I went to Ndabankulu, I went to a school where I found out that last year only, that was 2023, 27 kids were pregnant, 14 in one class. And we said, together with other NGOs like Beyond Zero, we are going back to that community. We want to investigate. We want to see what is it that we can do, because it seems as if whatever strategy that we're putting in place is not really giving us the results that we want. We've established youth zones in our facilities, about 500 youth zones that we have, but we still get the teenage pregnancy, especially in the area of Alfrenzo and OR Tambo. So we want to put more energy and come up with other strategies of dealing with the issue of teenage pregnancy.
All right. Thank you so much, MEC. That is the MEC of Health in the Eastern Cape, Katlego. Now, of course, we're about to actually go into one of the labor wards where we're going to see the new babies who will be given, of course, gifted with things they can take home with. Now, some of them are people who come from the townships nearby or actually disadvantaged areas within the Nelson Mandela Bay Metro. This is the main ward, which we know that has actually bringing in a number of mothers from various areas come to give birth here, not just in the Nelson Mandela Bay Metro, but the surrounding local municipalities as well come here, which also ends up being an issue. Now, Doranginza is also known as one of the hospitals, or rather maternity wards, that is under-resourced, where a number of years ago it was found that some mothers were actually sleeping on the floor. So now we've reached the labor ward, the maternity ward, and we're seeing the new mothers, and the MEC will now be handing over these gifts and meeting the new mothers.
All right, so that is the MEC Ntandokazi Kapa, the MEC for Health in the Eastern Cape, doing her first walkabout at that hospital, the Doranginza Hospital in Gqeberha, where a number of children, 50 to be precise, have been born since 10 a.m. this morning at that hospital. And of course, that one concerning issue of the 12-year-old mother who has now given birth. And of course, as the MEC has highlighted, the father of the child is a 17-year-old boy. And of course, the department is saying that they will ensure that the mother of the child stays in the hospital until their investigations with regards to what exactly happened in that case. Because as you know, a 12-year-old is not of consenting age when it comes to sexual activity, and the 17-year-old is, of course, of consenting age, and therefore this is then regarded as statutory rape. But of course, as you see, the MEC, flanked with some other members of the health department, just giving away some new hampers and goodies for the new mothers who have given birth since the start of this new year.